show. The Ministry of Health says children are now more susceptible to disease as they do not receive the necessary immunization on time. They say parents' ignorance of the immunization cycle is the major contributing factor. To sensitize parents on the importance of completing the immunization cycle, the Ministry of Health, in collaboration with the coalition NGOs, organized a deba at Shaibu here in Accra. My colleague Faustina Safo was there.
Good health is important to us. The nutrition we get from food are really important. So let's take it one at a time. What do we do? Hello? Dubbed the second year of life, the deba was to shine the spotlight on the importance of availing a child to receive the necessary immunization once due. Health Promotion Officer at the Mamprobi Clinic, Pearl Jojoji, speaking on the sidelines of the deba, says an analysis of immunization report showed the initial immunizations administered to children at 9 months do not give the required protection, hence the need for parents to follow through with the immunization cycle.
We want the parents to put the children their weighing card into their school bag when the community health nurses demand for the weighing card. They just want to see if the child has taken all the vaccine and the child is fully protected or not. We realize that most of the children that we give the measles rubella vaccine to at 9 months, it doesn't give them full protection. So we have the Ghana Health Service in collaboration with Ministry of Health and then our developmental partners, including coalition of NGOs, they've realized there is a need for us to booster the measles rubella vaccine at 18 months for the children to get full protection.
Queen Mother of Dansuma Na Abba Quino I charged fathers to weigh their support behind their wives, even as they ensure their children complete the immunization cycle.
These days, some of the mothers, they are not serious taking care of the children. I would like to advise them that they should take very good care and make sure they will take the immunization from 18 months to 5 years. And also, some of the men, they leave their wives to go there for the weighing. But I would like to advise the men as well, because when the mothers are busy, so who is going to take the child to the weighing? Sometimes the men have to support their wives.
Chris Sapon, Executive Director of Recreational Home Foundation, a partner in NGO, is certain health risk of children could be reduced if community leaders take it upon themselves to sensitize their communities.
If you go to hospitals right now, children's ward, you can see a lot of children with different sickness, all because the parents did not patronize the immunization. And because of that, the ward has become so many that there are no medicine, and then you can't pay the amount. So the best is you have to prevent it before it occurs. So doing that, we are appealing for all parents that when the immunization project started, everybody must send their children to the center, or the community nurse will come house to house so that every child will be immunized.
For JoyNews, Faustina Safo.
Well, we're told that armed police and military personnel stormed the residence of embattled businessman Alfred Agbesi Woyome. We have an interview with him. We'll bring you that interview. But before that, some unemployed allied health nurses have been picketing the premises of the Ministry of Health over their delayed postings. They contend about 300 of their colleagues have been posted, but their postings delayed because their names were omitted. The unemployed nurses say they will not leave the premises of the Ministry of Health until they are posted. The Public Relations Officer of the Ministry, Robert Kujo, however, says that the omissions were caused by the Allied Health Council. He promised the aggrieved nurses they will receive their postings next month. Maxwell Agbaba has more in this report.
Yeah, our reason for coming here is that initially we came here for picketing. That was some months back.
Yeah.
Then the Honorable Minister, Honorable Tina Mensah, came out and told us that, and the general public, that allied health professional, we have been offered 495 financial clearance, which we were happy, and we thanked them for that. So it was unfortunate that after the clearance, when the posting came, we got to realize that it was only 355 who were posted. So we consulted them and they told us that it was an oversight, but we shouldn't worry, they will work on it and ensure that we are posted on the same day with our colleagues. But currently, as I speak to you, our colleagues are at the full. Some started work last month and some last 2 months, and we are still sitting at home hopeless. So we contacted them, with this several press release, and they keep on giving us promises upon promises.
Well, the environment here is not the best. You are carrying your bed. I want you to share with us your experience sleeping here yesterday. Tell me.
Yesterday, I came here 5 o'clock in the morning, a.m. That was when I arrived here. And I've been staying here. I spent the night here. I only took kinky in the afternoon. That was it. We contributed one cedi, and then we bought kinky to feed ourselves. So this evening, last night, this is my mat. I laid it here where the car park is.
Okay.
And then I just lied on it with
no pillow. No pillow. Hard concrete floor.
You see from my shirt that it is dirty. You see from my shirt that it is dirty.
Yeah. Okay. So let's speak to. I don't know. Let's. Okay. So we just had the public relations officer of the Ministry of Health, Robert Kujo, here with us. We want him to respond to some of the issues that are being raised by this nurse. The public relations officer of the Ministry of Health just arrived here. We want to find out from him what communication or what engagements they've had so far with these nurses who are picketing here.
Yeah, we got here just this morning, and we met our brothers and sisters picketing. We asked their omission, and it's something that we know already. That has to do with their names that were omitted.
Okay.
In fact, we have 2 groups here. We have the registered community nurses,
exactly,
and then the other health professionals. Yeah. The omission, they know very well, wasn't our fault.
But whose fault
was an oversight from their councils, which they accepted, and we asked them to furnish us with the list of those who were omitted. And from the nurses, we have about 108, and then from the allied, we have about 140 or 140 plus. We got a letter. We've sent it to finance. We've been following up. We're waiting for the request to be granted, so that we can push them to the various stations.
Okay, so how soon is that going to be? Because their bone of contention is that they were not given any specific date, and that's partly contributed to them, sleeping here. They're saying that if you give them an assurance, give them a specific date, they'll be ready to leave this premises.
Specific date?
Yes.
So if somebody tells you that I'm going to pay you next week, next 2 weeks, next month, is it not specific?
So we just heard from Mr. Robert Kujo. He's a public relations officer here at the Ministry of Health. These nurses are saying that they want a specific time before they would leave this place. They want a specific date for their postings before they would leave the premises of the Ministry of Health.